Gender-affirming care has become a target for the political right and Republicans. Hundreds of pieces of anti-trans legislation, mostly focused on banning access to care for young people, have been introduced across the United States.
And Texas, along with more than a dozen states, have now banned gender-affirming care for minors.
They'll say it's health care. To cut off the private parts of a 14 or 15-year-old, that is not health care, that is mutilation.
The American Medical Association, along with other major medical organizations, opposed the bans and supported the care for youth when administered appropriately.
This will include medical care, adolescent medical care.
Gender-affirming care is critical to the mental health of everyone who is transgender or non-binary who chooses to engage with hormone therapy treatment, but particularly teens.
Puberty blockers, and I know that this is a bit of a controversial subject. Basically, by giving these hormones, you can slow down that pubertal process and prevent it from happening. Now, they can be used in adolescents until the age of 16.
Puberty blockers at age 12, however, where you're given a chance to get that time that you need to see if it is a real phenomenon, yes, that makes a lot of sense.
And for some of my patients who have significant dysphoria or who started puberty blockers at what would be maybe 8 or 9 years old.
If you ask me if her as a 12-year-old can understand and wrap her head around what's going on and what she thinks she wants, damn right she does.
We do have data to suggest that there are some differences associated with puberty blockers, including less bone density.
Bone density doesn't develop properly with puberty blockers, and for a few years, that's fine.
The bone density issue that you mentioned, that is the only significant side effect.
In one study, it showed that there was reduced spatial memory.
For example, if someone's in high school, a junior or senior in high school, and still in the body of someone who hasn't started puberty yet, and has a brain of someone who hasn't started puberty yet, that puts them completely off course with their peers, let alone causes health problems.
Luckily with Olivia, she's so young. She's only 7. The first thing would be a hormone blocker, and that's not until she would hit stage 2 of puberty.
If our patients are feeling uncomfortable with their gender identity when they first enter 10 or 2 puberty, then we would potentially pause their puberty.
Every single child or adolescent who was truly blocked at 10 or stage 2 has never experienced orgasm. I mean, it's really about 0.
Now, the next step is cross-sex hormone therapy, and this starts in early adolescence.
Those lead to some more permanent changes, like a lower voice or facial hair in transgender boys, and breast development in transgender girls.
Dr. Bowers, don't you have concerns about the reports that kids as young as 12 are crowdfunding for cross-sex hormones?
Starting hormones at age 12, no, I don't think anyone's in favor of that.
We are shortening the time interval now more and more at which we would put them on gender-affirming hormones. I may start them, at 13 or so.
He is counting down the days until he can start testosterone, which would be the first time something permanent would be happening, because at that point, it would affect fertility.
But I have no regrets, because if I transitioned when I was young, and I wouldn't have my children. I can't imagine a life without my children.
If you use a blocker and go on to testosterone, your eggs would never mature.
Mm-hmm.
You would have to go through female puberty for that, which is something you could do.
I could, but I don't want to.
Why?
Because it's uncomfortable.
With his little brother by his side, as he began transitioning at 13, he chronicled bits of it on TikTok. With psychological counseling and under supervision from a pediatrician, he started taking cross-sex hormones.
Okay, you ready?
By injecting testosterone.
And finally, there's surgery, which is rare for minors.
There's a wide range of surgical procedures, including top surgery, which shaves or removes breast tissue, and bottom surgery, reconstructing the genitalia, as well as tracheal shaving, a procedure aimed to reduce the size of the Adam's apple. There's facial reconstruction and hair removal.
How common is gender reassignment surgery on those under the age of 18?
Not very common at all. It is really rare, and it is the exception at this point to the rules, and for the most part to the guidelines that are in place.
She made history by becoming the youngest transsexual in the world on her 16th birthday. The 7-hour procedure is banned in England for people under 18,
So the Greens flew to Thailand, where at the time it could be done legally at 16.
You have been an inspiration to my work, which has made it possible for hundreds of young people to be treated like you.
The majority of surgeons around the world do something called penile inversion, where they basically use the skin from the penis to create the vagina. And she hadn't developed through full puberty, so to not put too fine a point on it, there wasn't much there to work with.
Taking Jazz on as a patient for surgery, we knew it was going to be a one-of-a-kind surgery. She's one of the first to have undergone complete pubertal suppression and lack of growth of the skin and other tissues, which we rely on as surgeons to do this operation.
I am someone who went through the gender-affirming care industry as a minor, resulting in the first medical intervention I ever had being a double mastectomy at 16.
My name is Chloe Cole, and I am a 17-year-old detransitioner from the Central Valley. At age 15, I asked to remove my breasts. My therapist continued to affirm my transition. I attended a top surgery class that was filled with around 12 girls. I was unknowingly physically cutting off my true self from my body, irreversibly and painfully. Our trans identities were not questioned. I went through with surgery.
Gender-affirming care is endorsed by every major American medical association, and they say this treatment is safe and can be life-saving.
I will never be able to breastfeed a child. I have blood clots in my urine. I am unable to fully empty my bladder. I do not yet know if I am capable of carrying a child to full term. In fact, even the doctors who put me on puberty blockers and testosterone do not know.